Alrighty, so you have a headache and you're coming into the clinic so that you can determine what type of headache that you have and what we're going to do about it. Well, first and foremost, to determine what type of headache that you have, we're going to ask you a fair number of questions. And that history is actually going to do a lot in order to help us make sure that you don't have a scary headache and determine whether it's a migraine or musculoskeletal headache and what type of MSK headache that could be. Again, if we're looking at those two types of MSK headaches, whether it's a tension type or of a cervicogenic headache, tension type headaches are very frequently all the way around both sides of your head. It's kind of called a helmet-like distribution, and typically, again, that pain is really dull and achy. If you have a cervicogenic headache, that pain is very typically just on one side, and sometimes it feels like that pain is directly behind your eyeball as well. Again, that pain is primarily going to be fairly dull and achy. But there's a couple different ways that we can determine between those two different types of headaches. In order to determine whether it's a tension type headache that is coming from some of those muscles, we can palpate those muscles to determine whether that recreates your headache. And there's a few very common muscles that will cause these headaches. First and foremost, looking into the front of the neck, we have a very large muscle in through here called your sternocleidomastoid that has two different muscle bellies to it. They both end up attaching to the base of your skull, and then one will go into the front of your neck, and the other will go down to the side. And this is, again, kind of where getting a little bit nerdy, where the name comes from. Both of the muscle bellies will attach to the mastoid process of the head. One muscle belly will go to the sternum, the other going to the clavicle. We can palpate through these muscles, assessing for any tension through the muscle. And if we find a tender point, we can press in through that tender point. And if this muscle is causing that headache, it will cause that pain to refer into the head. And that's how we know that it would be a tension type headache coming from that muscle. There are other muscles along the side, coming along the top through here, called your splenius cervicis and your splenius capitis. Again, we can palpate, finding tender points throughout the muscle belly, placing pressure on it, to determine whether that causes that same headache that the patient is experiencing. One very easy test that we can do to determine whether it's a cervicogenic headache is called a cervical flexion and rotation test. This places stress on the joints at the top of the neck and can help determine and recreate that headache. But in order to do this, we just take the patient's neck, flex their chin up to their chest as far as we can go, rotate to one side, determine whether that recreates the headache. Rotate to the other side to determine whether that recreates the headache. A final thing that we can assess in order to determine whether this is a cervicogenic headache is we can assess for tenderness or pain in the areas where those nerves exiting the neck are. Again, we have nerves exiting at the base of our skull here that end up traveling all the way around our head, called our lesser occipital nerves. These nerves are referred to as superficial cutaneous nerves, which means that they are directly beneath the surface of the skin. So if those nerves are sensitive due to some muscle tension or due to that joint irritation, if we pinch the skin near where those nerves are exiting the spine, that skin will actually be quite tender, recreating that pain. And that would be a good sign that that is going to be a cervicogenic headache opposed to a tension type headache. If we believe that the patient is experiencing more of a migraine, again, the history will help us determine that. The history will tell us that they're experiencing more of a pulsating headache opposed to a dull and achy headache. That headache is likely going to be one-sided and it can bounce from side to side. Patients are also going to frequently be sensitive to light or loud noises, and they very frequently will become nauseous or vomit. Again, migraines are a little bit of a different beast, and we can actually do very little within the clinic in order to help them. However, understanding that tension type and cervicogenic headaches are very common triggers for a migraine, if we treat the underlying tension type headache or cervicogenic headache, that there is mild evidence showing that this can help improve migraines in the future as well.